Hi, my name is Robin Crowley, and for our telehealth project, I would like to talk about vascular surgery and telehealth. So, for vascular surgery, there are a lot of different realms of medicine in this one scope of practice. We have carotid stenosis, we have peripheral vascular disease, we have dialysis access, we have varicose veins, and we have spider veins. Now, we see a high volume of patients in these areas under one scope of medicine. And with the pandemic, we could continue to see just about every one of those patients except the spider veins and the varicose veins. Now, the patients weren't too happy because those patients had problems too. And, because those problems aren't as dire as the other ones, we had to make a decision on not to bring those in during the pandemic. And I believe if we had telemedicine set up back then, we could still see our vein patients. I have a passion for vein patients. I feel these patients, they have pain, they have problems as well as the other ones. And I'm in hopes that we can build up a telehealth practice in order to see these vein patients. Our text defines video conferencing as a 2-point or multi-point communication tool where face-to-face live communication takes place using multimedia. And in doing this, our vascular physicians would have a block of their time to use teleconferencing built into their clinic day, or we would have an entire day built to dedicate to our vein patients. Why telehealth? Having these patients on video conferencing would decrease the need for these patients to come into the clinic. Our providers would have the ability to see these patients after hours, evenings, or even on the weekends, allowing our office to see more patients. The goal of moving these patients to conferencing for our vein patients would be to eliminate another office visit for these patients. Telemedicine solutions enables U.S. companies to save up to $6 billion per year. The patient would get access to the provider sooner. The office would run more smoothly and more effectively. There are benefits to telehealth. Benefits. There's 24/7 accessing to providers through messaging. There's no copay. Some patients have upwards of $100 for their copays when they come in to see a specialist. We would be a specialist. That copay would be waived. It's safe, it's convenient, it's easy, it saves the patient money. There would be no parking fees. There would be no fees for transportation. It saves the patient time. And we could reach patients in rural areas. We can reach patients who just simply can't come into the office. How to build a sustainable telehealth practice. In order to build a sustainable telehealth practice, an office should have roles in place for this preparation. You must review legal requirements, build a workflow, work with your patients of your practice, and you must evaluate and make changes to your program as needed. Even if you have to make changes to your program weekly, monthly, you still should have to make those changes as frequently as you have to. How should a patient prepare for this telehealth visit? In order to prepare for this telehealth visit, the patient should be in a quiet location alone, where the physician is able to review medical history without fear of breaking HIPAA guidelines. At this time, we would ask that the patient would be in shorts so that the providers can see their legs. They should not have on any socks or any shoes. And make sure that their lower extremities, and their lower extremities are just their legs and their feet, are visible to the providers. So during this visit, the doctor or the CNRP are looking for veins in both the legs. They're going to be looking for varicose veins or spider veins in the legs. We're also going to send out measuring tapes for the patients, so then they're able to measure the veins for us when we're talking to them, and also take pictures of their veins and put stickers on their legs to show us the laterality. If they're talking about right leg, left leg, they'll take pictures, and then they can also upload these pictures to their chart. Our workflow process would be the patient would have to have an app on their smartphone to our portal. They would have to have either their smartphone, their computer, a laptop, or a tablet. The patient could call our office to get scheduled, or the patient could set up their own visit on our portal, and then they would schedule a visit with one of the doctors or the CNRPs for this visit. At the time of the visit, at the time of the appointment, the patient will be able to log on to the visit up to 15 minutes ahead of time to prepare. And then they will wait till the doctor comes on. And then when the provider gets on, the patient's identity will be verified by the provider once both parties log on. Again, the patient should be wearing shorts so that the provider can see their legs. They should not have on any socks or shoes. And they should make sure that their lower extremities are visible. During this visit, the patient and the provider will go over their current symptoms of varicose veins. Example of this would be if they're having any pain in their legs, if they're having any swelling in their legs, if they're having problem walking any far distances. They will discuss if the patient has been able to do anything to help with the prevention of varicose veins. This will be an example of walking and leg elevation. If the patient is found to have symptoms of varicose veins, the patient may also need to come into the office for a reflux study. Now, the patient doesn't have to pay for a reflux study that day, but if they have any deductibles or co-insurance, that will hit their insurance. But that will be performed in our office or a radiology facility, and we can provide a prescription for that. After the video conferencing is done, their chart will be sent to the physician's administrative assistant, who can schedule the radiology study and their follow-up discussion with for the report. So after, if the patient needs a study, that report has to be gone over with one of the medical providers. The patient should get the ultrasound done as early as possible within the next business day, so they're not waiting for medical results. And then an insurance requirement is that the patient should wear compression hose for at least 3 months. And so if the patient has not been wearing compression, we would also do that visit. We would see them back in 3 months, and we would also do that visit on a telehealth visit. So the patient, again, would not waste any money, or the patient, would save money during another telehealth visit instead of coming into the office. After 3 months, the patient would have another, video visit. If it has been determined that the patient needs treatment, the patient then will have to come into the office for treatment. Then the patient's chart is then routed again to the correct administrative assistant or scheduler to get scheduled by the provider or with the provider for their first available appointment. In conclusion, I think telehealth has opened up a world of possibilities for the patients, and it has become very beneficial for both the patient and the providers, and I think it's only going to keep growing. Telehealth just really kicked off mainly for the pandemic, and now it's 3 years later, and we're getting into the swing of it, and I'm excited to see where we can grow and where it can go and how it can grow and how many more patients we can see from it. Like I said, I think that my patients were very unlucky not to have telemedicine when the pandemic first came out, because so many of them suffered, and I don't want that to happen again. So I am truly glad that telehealth now exists, and I want to hopefully keep this practice going and integrate it to vascular surgery and see what we can do for our vein patients. Thank you so much for listening.